Hola, hola, y bienvenidos a Tu Salud, the definitive podcast for Latine and Indigenous health policy, where we talk about all things Latine, policy, and our health. I am Dr. Ceci Aquino, Executive Director at the Latino Coalition for a Healthy California. And today I am joined by a fierce Latina, President and CEO of the Children's Partnership, Mayra Alvarez. Today we'll be talking about the healing touch of a mother, healing through our cultura, and seeing the world through a child's eyes. So let us get started. Amiga, bienvenida. Thank you so much for joining us today. And just to get us started, tell us a little bit about your story. Who are you? Where do you come from?
That's a big question, Cecia. So thanks so much again for the opportunity to be with you all and for hosting this incredible space. I'm honored to be included. My story. So I think I'll start by saying I am the incredibly proud daughter of Mexican
Mm-hmm.
immigrants. And I carry that experience with me in
Yeah,
everything I do.
yeah.
I am the first in my family to be born in this country.
Mm-hmm.
And I carry that with me in everything I do, the recognition of that privilege. So I was born in El Centro, California, in the
Uh-huh.
Imperial Valley.
Uh-huh.
My family is from Mexicali. I have a lot of family still in Mexicali, and maybe that's where my love for the heat comes from, right? Because it's very warm down in the valley.
All right.
But I moved. My family moved to El Cajon, which is like a East
Mm.
County of San Diego, when I was 4.
Okay.
So like I was raised in El Cajon and really consider that home.
Got it.
Um, my family, my parents are two of the hardest working people I've known in my life.
Of
My
course.
dad has always been like a purveyor of like fruits and vegetables. Like he would
Mm.
go to to different vendors or to the fields and get
Uh-huh.
oranges or sandia or
Yeah.
vegetables and then deliver it to various restaurants like his entire life.
Yeah.
Honestly, to this day, he still does it. Doesn't
Oh.
do it as often because he's now significantly older.
Mhm.
And then my mom, for the longest time when we were growing up, worked in like a small produce market, like a small
Mhm.
business.
Mhm.
And from there, also learned
Yep.
fruits and vegetables, and was a business owner. They eventually became a business owner. But I vividly remember that they worked incredibly hard, Monday through Sunday,
Yeah.
and my parents never owned a home. They never had like a retirement plan.
Right.
We didn't always have health insurance.
Right.
So, like, something was up, right? So, I
Yeah.
carried those experiences with me.
Yeah.
I went to college at UC Berkeley, go Bears, and opened my eyes to like public health.
Yeah.
I went thinking I was going to be a doctor. I think many people do.
Mhm.
And then I
Mhm.
took science class and was like, that's not going to happen.
Like, no,
But
thank
not
you.
because it was more so like where could I make more of where I felt I could make more of an impact on
Right.
community. And I took a public health course and it like changed my
Yes.
life.
Yes.
And I also was a Chicano studies major.
Mhm.
So I learned a lot about, or I learned to appreciate how culture impacts
Yeah.
our well-being. And that was I wrote papers on that,
Yes.
thinking about just all the things that our culture brings to us in our
Yeah.
well-being, in our health. And so I knew I wanted to go to the School of Public Health
Yeah.
for graduate school. I did a summer program at the University of Michigan and it got exposed to public health as a career. And so I
Mhm.
applied to schools of public health and I went with whoever gave me the most money.
There you go.
And thankfully, I went to an incredibly good school, the University of North Carolina at Chapel Hill, and I went east.
Wow.
And it sort of like launched my career.
Yeah.
I did an internship in DC and then drank the Kool-Aid on the ability for policy to make a difference.
Yeah.
And so I stayed in DC for 10 years working on health policy.
Right.
At that point, there wasn't a lot of Latinas
Yeah.
working on health policy in Washington, DC. So the ones that were, we kind of all knew each other and
Mhm.
supported each other and had each
A
other's back.
community.
But it was very much this recognition that policy is public health at its greatest level,
Yeah.
that changing policies potentially changing opportunities and health
Mhm.
for millions of people.
Yeah.
So it was quite a special time to be in DC. I was also in DC when it was then President Obama and we passed the
Mhm.
Affordable Care Act. So throughout all those experiences, bringing the fact that I am a proud daughter of Mexican immigrants,
Yeah.
bringing that I remember, helping my family with
Yep.
many questions to this day about health insurance and about going to the doctor
Right.
and what it means to be healthy. And so I feel really proud of that background, and I
Yeah.
hold it close to my heart in our advocacy every day.
I love that. From helping your family navigate the systems to you influencing and transforming the systems to be a lot more receptive to what our communities need, right? I think that's a beautiful way to see it. Now let me ask you, yeah. Now let me ask you, was there a story or a moment in time that you remember from your childhood or growing up with your family that still to this day, you recall or that roots you in the health equity, health justice work?
Yeah, I have a lot, absolutely. So I think one overarching one is I don't think my dad ever went to the doctor.
Mm,
I don't think my
mm-hmm,
mom
mm-hmm.
ever went to the doctor until we were older and we
Right.
could really advocate for, "You have to go to
Yes.
the doctor," right? Like,
Yeah.
I don't remember that
Yeah.
being just the priority for her,
Yeah.
right? It just wasn't. Yeah. Um, at the same time, I vividly remember my mom talking to us about health and well-being and how fortunate we were to have various ways of supporting our health and well-being. And I'll say,
Mm-hmm,
like,
mm-hmm.
part of that is, being in community with our family,
Yeah.
right? That in and of itself is healing, but
Yes.
also like a lot of remedios,
Yes.
right? Like I vividly remember, and I know you and others, like Vicks Vapor Rub,
Yep.
right? Like I
Vaporub.
still to this day, I carry Vicks with me when I travel. Like it is
Yes.
just, and it could be psychosomatic, it could be right, it could be real, but like
Yeah.
it is healing to me
Yeah.
to be able to use that and to remember the power of my mother's hands
Yes.
in healing me and in her
Mm.
touch. So those are all those are just things I hold and I treasure. But
Oh.
I will tell you, when I was in high school, I had this really bad like stomach pain, and
Mm.
it was just like really, really bad.
Yeah, yeah.
And to the point one day where I was like, "Mom, like I can't stand up, right? Like something
Yeah.
is happening." And she took me to like the local clinic, like
Yeah,
una
yeah,
clínica,
yeah.
right? Like a health center, down Madison, which is like this main street in El Cajon. And we went, and I remember I was in so much pain. Like I leaned against the wall, and I think I may have blacked out. And I say,
I
but I was,
know.
and then we were in the doctor's office, and I remember I had a doctor. I believe her name was Dr. Paris, if I can remember,
Okay,
and she
okay.
spoke to my mom in like kind of broken Spanish, right,
Mhm,
a little bit.
mhm.
But I remember her trying to communicate
Yeah.
to my mom what was happening, and we ended up going to the emergency room. I had an ovarian cyst that had to get
Oh,
removed. Yeah.
no.
Everything was fine. Everything was fine. It was,
Okay, good.
we were able to do it through laparoscopy. But I vividly remember that experience
Yeah.
because there was a clinic that we knew,
Mhm,
and that's where we had gone, and that's where we felt comfortable.
mhm.
And Dr. Paris, my mom trusted her. That we
Yeah.
had a doctor that was trying to communicate to my mom in a language that she understood, and
Right.
that, to help her feel comfortable.
Yeah.
And, I had a mom and a parents that would do anything
Mm.
to make sure I was okay. Right.
Mm.
And I think that's an experience that's universal across cultures, across
Yes.
families, that we want to feel dignified when we go to the doctor. We
Yes.
want to feel heard and valued. And that as parents, we want to do everything we can, or caregivers to do everything we can to take care of our child.
Yeah.
So like if we can take that experience, and thankfully everything turned out fine,
Yeah.
if we can take that experience and make it happen for everyone, that's what this work is about, right?
Yes.
So I think that's the one that I hold like
Yeah.
really, really near and dear to my heart, because I can close my eyes and be there again.
That's beautiful. Thank you for sharing that with us. I think that really resonates with me. I think our parents are trabajadores, right? Day and night, they will sacrifice themselves, their health for their children, and they forget to take care of themselves. And, then we learn, right, to advocate for their health and to make sure that they're taking care of each other so we can still have them around and enjoy their healing touch, like you said, right?
Absolutely,
I love
absolutely.
that. I love that. Can I ask you, Talking about mothers and how special and sweet and, their healing touch. What was it like becoming a mother yourself?
Oh my gosh. It's an incredible gift. Like I can't, it's so strange, Cecilia. Like I can't even
Oh,
like imagine life without this little one now, right? Like life is
oh,
so different. My
yeah.
husband and I would joke around like, life was really different 3 years ago or 4 years ago, right? And
My
I can say that
goodness.
within this context of life was so different for so many of us, right? Like
Yes.
if we can think about before the pandemic,
My goodness.
it's pretty amazing to think about. And as challenging as those years were for so many people, and as
Yeah.
as tragic as they were for so many people, at the same time I got this amazing beautiful daughter in that time.
Mm.
So and I was able to be with her
Yeah.
in ways that I don't think that I would have if it not been for the pandemic and this expectation
Mhm.
that we have the privilege of working from home and that we
Right.
have the privilege of saying no to travel and being safer.
Yes.
Like I can't even fathom
Yeah.
not having that gift, right?
Yeah.
Especially as I talk to other moms who
Yeah.
didn't have that experience.
Yeah.
But life with my little one is an adventure every
Oh,
day.
that's so
Um,
sweet.
every day it's like fun and like
Oh.
they don't care about anything that's happening. They just want to be with you and they want to play,
Oh.
right? She'll be 3 in July, and it is so fun to ground yourself in the
Yeah.
joy and in the imagination
Oh.
and the possibility of what
Right.
the day will bring in the life of a little one. So I'm very grateful to have
Oh.
this incredible teacher, this new teacher in my life
Oh.
that I can almost like live life all over again,
That's so
and
sweet.
also like remind me of what it's all about. Like
Yeah.
that's what it's all about. It's about family. It's about connection. It's about love. Um,
Yeah.
and if you start your day that way, you know, it, it's a pretty good beginning.
Oh, I love that. I love that. And it makes me think of a lot of the conversations we have around mental health and healing trauma, right? We always go back to healing your childhood, right? And the many experiences that we went through. And I feel like motherhood places you in a position, like you said, to almost have another go around at childhood and sharing that with a very loved and special little one.
Oh my gosh, that's such a great statement, because you get this do over of being able to heal that inner child and let them come out a little bit, right?
Mm-hmm.
And it's interesting over the last few years, we bought like coloring books and right, not for her, before my child, right? Because like,
Right,
there was
right.
adult coloring books and stuff, and we would use them from time to time. But like I color so much more now.
Yes.
And I probably enjoy it more than she does, right? Because it's
I
like
love
therapeutic
that.
to color and to
Mm-hmm.
do little things that
Yes.
again are just in that moment. You are
Yeah.
just in that moment with your child, and to do that. And I think
Yeah.
I also am really grateful for like I'm a relatively older mom. Like I'm pretty old. I had my
Estás
child right.
jovencita. What are you talking about?
Older. But that's okay. I feel like that's also without knowing, because I wouldn't know any different. Without knowing, I feel grateful that I'm at this stage of my life where
Yeah.
I'm a bit more stable
Yeah.
and I'm a bit more patient at, oh, these are all normal childhood development things that are happening,
Right.
right? This tantrum,
Right.
cool. I see you. I see you asserting your independence, right? Like, and also like there's a lot of information coming at us that we can absorb,
Right.
so that part, but it also gives me this reflection of, my mom didn't have that,
Mm-hmm.
right?
Mm-hmm.
And her mom certainly didn't have that. And to your point about trauma and healing, like we have to take a step back and know that our parents did the best they could with
Yeah.
what they had, right? With
Yeah.
the norms, with the practices that were acceptable,
Right.
and that we can end
Yes.
things that weren't working for us, that
Yeah.
didn't work for us, and do better,
Yes.
right? And try our best, right? Nobody's perfect. We're all trying, but
Oh,
I'm conscious of that, and
yeah.
I'm grateful that there are these resources to learn more about how to break generational cycles of trauma,
Yeah.
and also not recognizing that it's not all intentional, but it's just these
Yes.
practices that emerge, la ropa sucia se lava en casa, right? Like we
Uh-huh.
don't talk about certain things. We
Right.
don't want to air dirty laundry, or
Right.
so to speak. And actually that creates some
Mm-hmm.
like hidden, feelings of tension
Yeah.
that are not healthy for our bodies. They're not healthy for our relationships. Like, to be
Exactly.
able to talk about that. And I'll give you a story. My little one,
Uh-huh.
she'll be 3, but for the last few months now, she's been saying this thing of, Mommy, sometimes I feel sad.
Mm.
Sometimes I feel happy.
Oh.
Sometimes I feel frustrated, right? And I'm just, like, amazed that,
She can name her
she's able,
feelings.
yeah, she's able to communicate, right? 'Cause
Oh.
I don't know if we did that, right?
Nope. I feel like
It
I
was like
just learned to identify my feelings.
exactly, exactly. So I
Oh.
again, like, we're all sort of works in progress and trying to do better than we did yesterday. And as a mom, I certainly am trying to do better than I did yesterday, but I really appreciate this little girl who is teaching me every day that I can try again.
Oh, I love that. I love that. Thank you for sharing. Also, I can't believe it's almost 3 years. That went by so quickly.
Right? It's wild.
Oh, that's great. How do you think, being the leader of this amazing organization, the Children's Partnership, and with that focus, right? And now your experience as a mom, tell me a little bit about that.
Yeah, that's thank you for that. So I feel really privileged, and we've talked about this, you and
Yeah.
I. I feel really privileged and honored to be able to lead an organization, right? Especially as a Latina, as a daughter of immigrants.
Yeah.
I hold that opportunity very close, and I'm proud of it. And at the same time, I want to do the most good possible with this
Mm-hmm.
opportunity, not only for myself, but most importantly for the mission we're trying to meet and
Yes.
for the team that you're trying to build, right? Like, how do
Yes.
you create an environment where people can feel connected to the mission, but also feel valued for their contributions and
Mm-hmm.
feel seen as whole people? Yeah, that work is really hard.
Yeah.
And especially in our work as children's advocates, I'd
Yeah.
like to consider myself like I'm a lifelong child advocate, I'm a lifelong health advocate,
Yeah.
really thinking about how to advocate, particularly for families that may have had similar situations to mine, right? That may
Yes.
not have had all the resources in the world, but that were rich in
Mm-hmm.
culture,
Mm-hmm.
and that were rich in community, and rich in connection,
Yes.
that serve as these incredible, as you know, protective factors
Yeah.
that build resilience and that make us capable of so much more, right?
Yeah.
Like, the possibilities are endless if those doors are open to us. So in thinking and holding that, I think our job as child advocates is just incredibly um, impactful, or
Yeah.
can be
Yeah.
incredibly impactful. And we really believe just how, as an individual person, I cannot raise my child alone, right?
Mm.
My partner, I've got my mom, my
Yeah.
sisters, my community, I've got friends, like like the village, right? That helps us raise my little girl, and
Yeah.
that she is loved and protected because of that.
Yeah.
So too are we that much more effective in our advocacy
Yes.
when we are advocating as a village, when we are advocating in partnership with
Yes.
organizations like LCHC and others for a shared agenda for child
Yes.
well-being. So I think that there's a lot of, like, translation.
Mhm.
And I will
Mhm.
say, maybe sometimes that's not the healthiest, right?
Mm.
I feel like I'm not at a job that I'm like, okay, it's 5 o'clock, I'm done with my
Right.
job.
Right.
Like, this is life's work,
Yes.
right? We're fighting for
Yeah.
kids that look like us. We're fighting for kids
Mhm.
that are that we feel deeply.
Yeah.
Many of these families are our
Yes.
families, right? So
Yeah.
I'm very conscious of
Yeah.
of of that responsibility,
Yeah.
and opportunity,
Yeah.
and at the same time doing my best to balance. I say that in
Yes.
quotes because
Yeah.
it's never a balance, right? But at least be conscious of it, and
Yeah.
conscious of it for not only myself, but for my team members who are also
Yeah.
often reflective of these communities. And sure, you feel that deeply.
Yes.
Um, but I feel very privileged and honored to be in this work and want to do, the best we can with the opportunity.
Yeah, no, and thank you for sharing that. I just want to say I admire you and all the amazing work. We need you in this work. We need your voice and your fierce passion for this advocacy work. But I just want to call out, yes, it's a privilege to sit in that role, but Mujer, you've worked hard from your amazing work at the federal level with CMS, with HHS. You've been leading this work. So yes, it's a privilege, but also the organization is privileged to have you at the helm, right? And you leading this work. So I just want to also voice that.
Thank you, amiga. I really appreciate you saying that. Yeah. I mean, we work hard, right?
Yeah.
Like same with you, right? We are in this together, right? We've been holding it, holding these experiences with
Yeah.
us. And I think as a result of it, are bringing different perspective and um, life to the work,
Yes.
to the advocacy for health in ways that I think is making it stronger. So
Yeah.
right back at you, right? Like I
Mm.
can't imagine what it's like to be at Harvard as a Latina and
Mm.
you carry your story, your experiences, right? Like there's no perfect manual for here's how you run an organization,
Right.
right?
Right.
Here's how you show up
Maybe
as
we
a
should
good
write it.
boss.
We'll
That's right.
we'll
That's
publish
right.
a book on it.
Okay, all right. I got you. I'll hold you to that. And
Mm.
we're learning, right? We're
Yeah.
also figuring this thing out. And I'm so grateful for partners like you, both as organizations, but also
Yeah.
as people, as women, as Latinas,
Yes.
to say, hey, I'm feeling this way, or
Yes.
have you ever had to deal with this? And that
Exactly.
support, that village is what gets us
Hmm.
through. And I'm grateful for it.
Yes, it's that comunidad. We gotta keep
Yes,
supporting each other. I love that.
absolutely.
I love that. You mentioned using these other experiences, right, to influence and inspire our work now. Can you or do you mind sharing a little bit more about your time at the federal level and what that lens helps you in your work today?
Yeah, absolutely. So I went into the federal government. I went to DC in 2005,
Mm-hmm,
right?
mm-hmm.
And I feel, oh my gosh, that's such a long time ago. Uh, and I vividly remember. It was the summer before between, oftentimes in graduate school, they make you do like practicums,
Yes, yes, yes.
right? Where you have to go and have an experience and then come back and write about it. And I remember I was in Washington, D.C., and I was working for the HIV and AIDS Bureau. And
Mm-hmm,
my mentor was my preceptor, right? My boss
mm-hmm.
was like, hey, if you ever come back to DC, you have to work on Capitol Hill. And I'll be honest, yeah, like I wasn't super politically involved. Like I would vote because you turn 18, you're supposed to
Right,
vote,
right.
right? And I wasn't like I just wasn't that attuned to that
Mm,
to politics in general. And I
mm-hmm.
was in my apartment in DuPont Circle in DC, and I was cleaning, and I had the Democratic National Convention on in the background. And I know we're not talking about
Uh-huh.
politics, but I'm just saying.
Yes.
So the Democratic National Convention was on in the background, and I was cleaning. And I stopped because I heard someone giving a speech about red states and blue states, and we all want
Mm-hmm.
to, do the right thing. And
Mm-hmm.
and it was Obama. It was
Mm-hmm.
Barack Obama when he was a state senator in Illinois. It was 2004, the summer.
Mm-hmm.
And
Mm-hmm.
I realized I was like, oh, I can get with that. Yeah, absolutely. I can listen to that. I can follow that. Absolutely, that's inspiring.
Right.
Um, and so when fast forward, when I was looking for a job, there was this health policy fellowship that
Mm.
you applied for, and it would take you to DC, and it would pay, for your fellowship opportunity. You'd be free labor somewhere,
Mm.
and it was a wonderful fellowship. It was called the David Winston Health Policy Fellowship,
Uh-huh.
and that fellowship changed my life. It
Mm.
changed my life. Like I didn't have connections on Capitol Hill. I
Right.
wouldn't have known how to navigate those waters. I didn't
Right.
I didn't know anyone that had ever worked for a congressman or a senator.
Right.
And so this fellowship opened those doors. So the first few months was like informational interviews, right?
Right.
And then you get to pick or hopefully pick where you want to get your
Mm-hmm.
placement. And
Mm-hmm.
I met with then Senator Obama's staff and was really just inspired by their commitment to health equity, right?
Yeah.
Or minority health and health disparities
Mhm.
back then, right? That's how it
Mhm.
was referred to.
Yeah.
Um, and Dr. Dora Hughes was like the legislative assistant, and she was like, "Well, if you come here, you're going to have to really like roll up your sleeves and get to know." And I was like, "Absolutely!"
Yes.
And it literally changed my life. Like
Wow.
I got there and was able to not only be exposed to,
Mm.
again, policymaking and the legislative process and
Yeah.
how Congress works, but also to these incredible professionals, many
Yes.
of color, that were in policy, that were
Yeah.
in communications, that were doing incredible work,
Yes.
representing their community, holding that down. And it made you believe you could.
Right.
Right? It
Right.
made you believe, and especially working for someone like then Senator Obama, who was already getting all these rumors about, "Oh, is he gonna run for
Yeah.
president?" And, "Oh, what's gonna happen?" And be in meetings and listen to, his great questions and his analysis of things.
Uh-huh.
I again, I drank that Kool-Aid a really long time ago. And then afterwards, I remember I was trying to figure out what to do after the fellowship,
Uh-huh.
and there was a job opening with Hilda Solis. And in it, it
Right.
said, must have 5 years Capitol Hill experience. And I was like, Dora, I can't apply. I don't
Mm.
have that. She goes, yeah, you can. You can apply. You can still apply.
There you go.
Absolutely. Right. So that was my first experience of
Yeah.
many of us, we see some job requirements and we're like, we can't, we don't
Mhm.
qualify. Well,
Mhm.
no, go after it. If you think you
Yeah.
can do that job, go after it. That's what she told me.
Yeah.
And now I'm like, wow, absolutely. So I did, and I got it. So I
Yeah.
was able to be a legislative assistant for then Congresswoman Hilda Solis, who is
Wow.
an incredible champion
Amazing.
for health
Amazing.
equity and for Latino health. I
Yeah.
remember she was the chair of the Latino Health Task Force for the Congressional Hispanic Caucus at that time.
Yes.
So, like, imagine, right? Young Latina from California being able to work on these issues
Mhm.
for our community. I was like, oh my goodness, this is it, right?
Yes.
And then after that job, I went back to the Senate and worked for it's our Senator Dick Durbin, the senior senator from the state of Illinois.
Uh-huh.
And if anyone knows Senator Durbin, he was the lead author of the Dream Act. Right,
Amazing.
this man from Illinois, Southern Illinois, was
Mhm.
championing our communities. So
Yeah.
again, it was this reality check of who can be a champion, the
Yes.
importance of multiracial solidarity, the
Yes.
ability to find value in people as humans, as
Yes.
people, the dignity of people. So that was incredible, and I was with him the majority of the time on Capitol Hill, including during the debate on the Affordable Care Act.
Wow.
And then when it passed, I had the opportunity to go serve in the Obama administration,
Wow.
and I know. I vividly remember feeling so scared, and this
Mm.
is now 5 years in, maybe, like, almost 5 years
Uh-huh.
into
Uh,
DC. Like, what I thought, "I'm gonna go to DC for a year," right?
uh-huh.
No, like, you just these opportunities
Yeah.
open up, and I missed a lot in California. Like, I missed a lot
Mm.
of what was happening with my family, right? And at the same time was hopefully making them proud
Of
and letting
course.
them know that I'm holding you as I do this work.
Yes.
And yeah, and then I went over to the Obama administration and served for 5 years there.
Wow.
I was director of public health policy during the chaos of implementation of the Affordable Care
Yeah.
Act, but also the incredible opportunity to open up health insurance marketplaces
That's
for millions of
amazing.
people. And then I worked at the Office of Minority Health, again,
Mhm.
working on issues of promotoras and community health
Yeah.
workers and language access. And then I ended my time at CMS working on the state exchanges, like covered California, right? So,
Yes.
and that whole time in the Obama administration, I vividly remember, Cecia, like,
Mm.
how much I appreciated being like my mom's daughter,
Yeah.
right? The fact that I was a Latina, the fact that I was
Yes.
able to speak Spanish, and I don't even speak it that well. Like, my entire family will tell me I'm a pocha, right? But like, there, I could speak it well enough to communicate
Yes.
about the Affordable Care Act, to communicate
Mhm.
about this incredible opportunity that, frankly, will disproportionately impact Latinos
Yes.
who are more likely to be uninsured, who are more
Exactly.
likely to not have jobs that offer them health insurance, right? Like,
Yes.
this was a health equity bill. It was
Yes.
never it was never spoken about like that, right, during
Yes.
that time, but
Yep.
it was the biggest piece of health equity legislation our country has seen since Medicaid. And
Yes.
to be a part of that, like, I joke around, I peaked in my career real soon, right? Like, but I just feel so grateful,
Yeah.
privileged, like to have been in that space, to have been
Mm,
there and be able to be a part of that effort. It was just
yeah.
incredible.
That's amazing. Thank you for leading that work. I know it means a lot to all of us here, right? And the amazing work that we've been able to do since then, the type of access, the type of transformation that we've been able to achieve within California, right? In terms of the Health for All campaign and making sure that we all have access regardless of our citizenship status. So I think while it began, as you said, that initial system transformation, it evolved, right? And different states were able to take it at a different pace. And in California, we were privileged to be able to take it to what it is today and what we were implementing just earlier this year.
Absolutely, absolutely, and don't give me too much credit, Cecilia, right? Like, I was, like, one little itty bitty person in this, like, huge group of people that were doing things, and even that in and of itself, it, like, every day you're reminded how much collaboration and
Yes.
teamwork is essential to making change possible, to moving forward policy, and
Yes.
um, those same like pillars of teamwork and cooperation and patience and
Yes.
due diligence. Like it's in advocacy as well, right? It's in running a
Yeah.
nonprofit. It's how do you communicate
Yes.
effectively? All of those things carry over, and
Yeah.
to have been around some of the legends in the space, at least in my world of health policy,
Yeah.
it's an incredible privilege, and to your point, now here in California, we're able to continue that work that
Mm-hmm.
I honestly I don't think that the glaring gaps of coverage for our undocumented communities
Mm-hmm.
would not have been so glaring
Yeah.
without the Affordable Care
Yeah.
Act. The Affordable Care Act was like, hey, we're opening the doors to
Yeah.
coverage, except for some.
Yep.
So that is what really highlighted who's being left out here,
Yeah.
who's being left out, and I'm so proud to be from California
Yeah.
and who really, made a statement to say, "We're
Yes.
better than that, and
Yeah.
we're gonna make sure everyone that calls this state home has access to coverage." So,
Yes.
really proud to have come to California right as that was happening 'cause,
Yes.
there was incredible decades of work to get
Oh,
us there,
yeah.
right?
Oh, yeah. A lot of work. And we get to say now that California is leading the nation, right, in that work. Now, I
Absolutely.
know that we are in a unique space in time, right, with Health for All implementation started this year, the last leg of it started in 2024. But we're also dealing with the unwinding, the redetermination process, and unfortunately, the disenrollments, right? And I believe since June 2023 to February 2024, we've seen around 1.4 million Californians being disenrolled from care. And like we've shared, right, this safety net is life saving for our communities. What does that mean for us? Where are we? What needs to be done?
Yeah, absolutely. We've got some work to do, right?
Mhm.
I think part of the frustration that many of us feel is that these are programs that are supposed to work for people.
Mhm,
These
mhm.
are programs that people have a right to, that
Yeah.
they are eligible for, and that our systems are not set up in a way that allows people to have
Mhm.
access to those services. I think
Yeah.
that's the like frustrating reality. And I think that's
Yes.
true across program directors, across families, right? Like
Totally.
why isn't this working, right? And the unwinding right now, I think is evidence of how challenging these processes are for
Mhm,
people,
mhm,
right? I mean, you said it, like 1.4 million people have lost coverage, and the majority of them have been because of procedural reasons, right?
mhm,
Not because
mhm.
people aren't eligible anymore, but because they never got the package,
Yep.
that they mailed the package and the county never got it,
Right.
or they waited for an hour and a half on the call and actually they had to go back to work,
Yeah.
or they had to go take their kid to soccer, or whatever it is.
Yes.
Like that isn't an excuse for people to
Mhm.
lose coverage that could be life-saving
Yep.
or could be incredibly important to keeping themselves healthy, right?
Yep.
All the reasons.
Yeah.
So I think we have a lot at risk.
Yes.
In those out of those 1.4 million, it's about 300,000 children that have lost
Mhm,
coverage.
mhm.
300,000 children who, may not get the services that they need to address
Yeah.
a developmental delay or a
Yep.
vaccination, or I mean, you name it.
Yep.
And these are people's lives. So
Yeah.
I think for our community, for the Latina community that is disproportionately reliant on the Medi-Cal
Mm-hmm.
program,
Mm-hmm.
this is especially impactful.
Yeah.
Like I talk about health, and I talk about healthcare as a connector. Like
Yes.
health is connected to every single aspect of our lives, right?
Yes.
If we want our kids to pay attention in school,
Yep.
well, they got to be feeling well,
Yep.
right? If you want our parents to work a full work week and be
Yep.
productive, they got to be healthy. If we want our community members to be good, productive community members, they got to be
Exactly.
healthy, right? So, how do we see this investment in making this program work for people? Not about a program, but about
Mm-hmm.
all of us and our
Mm-hmm.
well being. And I think shifting the conversation in that direction will
Yes.
help us ensure that that happens. And I want to give credit. Like, I think we're trying.
Oh,
The state
yeah.
of California, the
Yes.
departments, our counties, people are trying. There's been
Yes.
education campaign.
Yes.
Partners are doing all sorts of,
Yeah.
media opportunities and educational resources,
Yes.
and we just got to do more.
Yeah.
Like it's incredibly important to make sure we do more, and that we also take the steps to improve the programs where we can,
Mm-hmm.
right?
Mm-hmm.
We know these programs can work better.
Yeah.
If we think about the pandemic, it was a
Yeah.
public health emergency and people weren't losing coverage
Yeah.
because people were continuously enrolled, right? Like the
Yes.
federal government said, it's an emergency, keep everyone on the program,
Yes.
right? As a result of that, there was no loss in coverage for people,
Yes.
which is pretty remarkable during a public health emergency.
Yeah.
There were also flexibilities that the government gave us to make the program work better, right? Like, oh, you have a stable source of income, then we're just going to re-enroll you. Oh,
Yes.
you're also enrolled in this other program. If you're eligible for that, then you're eligible for Medi-Cal.
Yes.
Those opportunities,
Yeah.
those programmatic features can continue, right? We
Yes.
can continue that. And I think in the state of California, we want to see continuous coverage for young children.
Yeah.
We want to see continuous coverage for adults for a year. We want to see these federal flexibilities applied.
Yes.
And we've got some work to do. And I know LCHC and the Children's Partnership has been working hand in hand with
Yes.
others.
Yeah.
And I hope that we can see some progress on that moving forward.
Yeah. I couldn't agree more. And I think you said it right. This work is done in partnership. And there was some research that came out last year around the pandemic era safety net expansions, right? From child tax credit to that automatic Medicaid enrollment and other safety net programs that actually lifted communities out of poverty. So,
Yeah.
COVID provided a really interesting case study where when we do expand and strengthen the safety net, we not only protect and provide families for that time, but we're pulling them out of poverty and ideally helping them move forward, right? And be able to have more opportunities and to live well. So we know these solutions work. We know policy solutions work. We have the perfect examples in our hands, and we just need to continue to explore more of those sustainable solutions.
That's exactly right. I feel like the fact that we were able to cut child poverty in
Yes.
half
Yeah, that's
is
huge.
amazing, right? And I think it really demonstrates that when we prioritize the well-being of our communities, it can be done. It
Yes.
can be done.
Yeah.
And I completely agree with you. Like moving forward this momentum or leveraging this momentum, the
Mm-hmm.
opportunity is now. Like we're in an election year.
Yes.
Like what does that mean? Not only for the national level, but the state level. Like there are implications for all of us. And I think about that every day. And
Yeah.
and, and especially today, like the world is hard
Yeah.
right now for so many people. And where do we in our little sphere of
Mm-hmm.
influence, right? As
Mm-hmm.
I think about the Children's Partnership, I'm sure you think about the Latino Coalition, like
Mm-hmm.
where is our opportunity to make positive impact?
Yeah.
And what does that look like? And holding that close in order to follow through on
Yeah.
the possibilities, right? Like that's what it's about.
Yeah.
That's what this privilege is about, right? To do the best we possibly can. And
Yes.
I think the unwinding is one opportunity to make that happen, especially as we're seeing so many people lose coverage.
Yeah. 100%. And doing it in the way that you said, hand in hand with other communities of color, with other intersectional identities, right? We're stronger together, and the siloed work doesn't work, right? We're beyond that, and we got to continue to move forward in that way.
Absolutely. I think about that all the time. I really, I think about that, when we were working on, during the last federal administration, we worked a lot on the mental health impacts of immigration
Yes.
enforcement and what our
Yes.
children were watching. Even in a state like California that
Yeah.
has evolved so much in its commitment to immigrant families and immigrant
Yes.
communities, it didn't shield our communities from fear,
Right.
from a chilling effect
Yep.
of not accessing services, and from this reality of family separation,
Yep.
right? Of families being separated because of policies, right? Because of immigration enforcement.
Yeah.
And I vividly remember thinking about like this parallel and reading about this parallel between mostly Latina families that were being separated
Mm-hmm.
by an immigration system and Black families who are
Mm-hmm.
separated by a
Yes.
criminal, justice system, right? That
Yeah.
is not it is not meeting the needs of our families,
Yeah.
right? Like the history of our country,
Yeah.
the practices of white supremacy and racism and how it is embedded in our policies and programs is alive and well
Yep.
in many of our institutions. And being able to tackle that, being able to dismantle that or work at dismantling that
Mm-hmm.
is part of our responsibility as health advocates.
Yeah.
Because these systems, even though we may not work directly on immigration policy, we are engaged because of the health implications of what it means,
Yeah.
right? Of immigration status, whether it is leaving you out of certain programs or whether it is the fear of what might be,
Yes.
what might happen. There are all of these intersectional
Yes.
issues that are impacting our kids. And if we can see, if every child is our
Mm-hmm.
child, which we
Mm-hmm.
believe that, right?
Yes.
Every child is our child,
Yes.
then we have a responsibility to engage in that work together and to follow the lead of others that bring that expertise and
Yes.
and do right by our communities. And it's hard work, and I'm grateful that we're not in this alone, that we are in
Yeah.
this community of partners to try and make this place a little bit better than where we found it.
I love that. I love that. I think that's really what it's going to take for us to actually achieve health equity for the community.
Yeah, absolutely. Oh gosh. We have, there's there's a long way to go. I think a lot about and you all work incredibly hard on this is how do we what does it mean to value culture in
Mm-hmm.
our spaces, in our
Yes.
health delivery spaces, right? We've opened up, I hope, that conversation more in the mental health space. Like
Yes.
what is it about culture that is healing?
Yes.
We think about it also in like the early childhood development space where people talk a lot about dual language programs, right? I'll
Mm-hmm.
tell you, like right now, I am really looking for a
Mm.
Spanish immersion, a dual language childcare program,
Yes.
an early learning program, right? My
Yeah.
little girl's going to be 3, so I still have a year before she goes to TK.
Uh-huh. Uh-huh.
Um, and I'm looking for a Spanish
Oh.
program, and I'll tell you, Cecilia, it's been really hard. It's been
Wow.
really hard to find one in San Diego, California.
You would
Um,
think there's access
and
there.
yeah,
Yeah.
exactly. So, like, if anyone, is listening and wants to hook me up with some information, please let me know. But really, it's been really hard, but it's important to me because obviously culture and
Mm-hmm.
language is so important, but it's
Mm-hmm.
also really important from an identity development perspective.
Yes.
To feel a sense of pride and connection with our culture leads to positive identity development,
I
which
agree.
leads to positive mental health.
Yes.
Research tells us that,
Yes.
right? So, like, this embracing of dual language programs
Yeah.
has to be just as impactful for our Latina families, for our families of
Yes.
color, as it is for our white children, right? Like
Yes.
there are multiple benefits, and for our children of color, it's an opportunity to develop a positive
Yeah.
identity, which leads to
Yes.
positive mental health, right? Like, and I think that that sort of perspective of these education programs, again, that health lens
Mm-hmm.
really just speaks to the intersectional nature of these issues and how we
Yeah.
can really value culture in ways that will help us achieve health equity in
Yeah.
the future. Just
I
one of many examples, but.
I love that. I love that. And what you said, right? There's healing in our culture. There's healing in accepting and owning our power and our beautiful diversity and our comunidad and our gente. And like you said, right? We have remedios, we have Vaporub, we have agua calientita con ajo. There's so many different. Mm-hmm. Exactly. So just being able to own that beautiful culture that we have and being able to share it with our other community members and our other communities of color and learn from them and grow together and heal together.
Absolutely. I think that's right. And I think California is a great example of that, of how diverse our communities are and the ability to see other cultures in our spaces and to be intentional about connecting our children to other
Yes.
cultures. We're really fortunate in California
Yeah.
to have just a wide array of people from all over the world here
Yes.
to give exposure to children. I mean,
Yeah.
um, I think children are this incredible reminder that we are all human, and
Mm-hmm.
that's what they see first, right? That is what they see first. And
Yes.
again, going back to this idea that my child is my teacher,
Mm.
there is so much to learn from our children about how we as adults can show up better in this
Yes.
world.
Yeah.
So just a reminder to
Oh.
think about what would a child do in this instant, right? As far as accepting others and being open and um, being in community with each other. I think that's what it's all about. And our kids remind us of that as they go play with complete strangers at parks or say hello and hold people's
Right.
hands, or right. Like it
Yeah.
varies, but it's a great, beautiful example of creating community wherever we are.
I love that. I think that's a perfect way to end our conversation today and just to think about as we move throughout our day and our week, right? How can we see the world through that child's lens?
Yes,
I love that.
absolutely. Thanks
Well,
so much for the opportunity.
muchísimas gracias and a
Aquí.
tu salud, amiga.
Gracias. Salud.